නිවසේ මෙවැනි මතු පිට රැඳෙන විස බීජ 99.9%ක්ම විනාශ කරන විම් ක්ලීනර්ස්.
Tonight. Okay for now. The Ministry of Health allays fears over oxygen supplies amid rising COVID cases, while the WHO issues Delta warning.
It's a warning that this virus is evolving, but it's also a call to action that we need to move now before more dangerous variants emerge.
Long awaited, over 700,000 doses of the AstraZeneca jabs reach the island.
From tomorrow morning, we are going to start the vaccination process. We are giving priority for the people who have already obtained their first dose, and the rest of the doses will be sent to Kegol district.
It's Saturday, the 31st of July, 2021.
හඳුන්වා දෙන නව ක්‍රියා ෂැම්පූ තුන්ගුණයක් ක්‍රියාකාරී ඇන්ටි ඩෑන්ඩ්‍රෆ් තාක්ෂණයෙන් ඉසේ සම පෝෂණය කර ඉසුරු ඉවත් කරමින් නැවත ඇතිවීම වළකයි. නව ක්‍රියා ෂැම්පූ.
From AdaDerana, this is AdaDerana First at 9. Live from Studio 24 in Colombo.
Good evening and welcome to First at 9. I'm Dhamke Knaik. Let's start with the local stories. Now, the Ministry of Health reassures that despite the country's increasing COVID cases, the healthcare system is fully capable of catering to the oxygen requirements of the patients and is even capable of upping the supply. With new cases on the rise at a global scale, the World Health Organization is also urging people to follow good health practices as prevention is better than the cure. Meanwhile, the National Operations Centre for the Prevention of COVID-19 outbreak announced today that at present there are no areas under lockdown, as the sole remaining area under isolation in the Jaffna district was freed today.
The gains Sri Lanka made by sacrificing freedoms in the form of strict travel restriction to curb the spread of COVID-19 looks to be in jeopardy. For a second consecutive day, the island's daily caseload exceeded 2,000 new cases yesterday. The epidemiology unit placed yesterday's figure at 2,460, 90 infections more than the previous day. The Western province continues to be the most affected. From its 801 fresh cases, the district of Gampa accounted for the lion's share, as it confirmed 535 infections. Colombo meanwhile reported 222 cases, while Kalutara recorded 441. It is, however, still unconfirmed that the hike in daily cases is the doing of the more transmissible Delta variant of the novel coronavirus. At this rate, the country is running the risk of its healthcare system being overrun. With that being the case, questions have been raised about the oxygen supplies at COVID treatment centres. Oxygen dependency has been a characteristic of the Delta variant, with more patients also prone to critical conditions.
There are considerable high number of people who require oxygen at this moment. However, the facilities available at the Ministry of Health are sufficient to handle the oxygen demand at this moment, and existing facilities are capable of catering the demand. Even further increase also can be managed. But providing oxygen or any other facilities cannot be made overnight. It will take time. Therefore, we have to curtail this increasing numbers. Otherwise, we will face a crisis situation. Therefore, what we need is to reduce the possibility of transmitting this disease.
After all is said and done, prevention continues to be better than the cure. Adherence to health and safety guidelines remains key to stopping the spread. The danger is that if the virus is left to spread freely, more dangerous variants than the Delta variant could evolve.
There are no golden silver bullets here. It's been the way for the last 18 months. The one magic dust we do have is vaccination. Problem is, we're not sprinkling that evenly around the world, and we're working against ourselves. So from that perspective, Delta is a warning. It's a warning that this virus is evolving, but it's also a call to action that we need to move now before more dangerous variants emerge.
So far, 4 variants of concern have emerged, and there will be more as long as the virus continues to spread. The rise is also driven by increased social mixing and mobility, the inconsistent use of public health and social measures, and inequitable vaccine use. Meanwhile, testing rates in low-income countries are less than 2% of what they are in high-income countries. leaving the world blind to understanding where the disease is and how it's changing. Without better testing rates globally, we cannot fight the disease on the front line or mitigate the risk of new, more dangerous variants emerging. We need more research and development to ensure that tests, treatments, vaccines, and other tools remain effective against the Delta variant and other emerging variants.
Ultimately, the WHO chief believes that when the pandemic will end is entirely dictated by the people.
The pandemic will end when the world chooses to end it. It is in our hands. We have all the tools we need. We can prevent this disease. We can test for it, and we can treat it. Almost 4 million cases were reported to WHO last week. And on current trends, we expect the total number of cases to pass 200 million within the next 2 weeks. And we know that is an underestimate. On average, in 5 of WHO's 6 regions, infections have increased by 80%, or nearly doubled over the past 4 weeks. Much of this increase is being driven by the highly transmissible Delta variant, which has now been detected in at least 132 countries.
In the meantime, State Minister of Bus Transport Services and Train Compartments Dilum Amanugama said today that interprovincial bus and train services will resume from tomorrow in accordance to the health and safety guidelines. He, however, stated that the public transport services will only operate in the mornings and evenings. The resumption of the public transport aims to cater to the requirements of the public servants who are called back to work from Monday.
Everything depends on the availability of transport facilities and avoiding unnecessary travel using the public transport. If we can do that, definitely the risk of getting the disease using the public transport can be minimized, for which the authorities, the administrators, the service providers of these transports also take this responsibility to their hand, and also the commuters also should take their responsibility and make sure that wherever possible, every time, first the health guidelines are adhered to so that the risk of getting the disease will be minimized. Because at this moment, we know that not only the public transport, but this disease could be anywhere.
In the meantime, 2,150 new COVID-19 infections have been confirmed so far in the island.
Now
then, the wait for the second dose of the AstraZeneca vaccine will soon be over. More than 700,000 doses of the jab landed in the island today as part of a donation from Japan via the World Health Organization's COVAX facility. The administration of those vaccines will begin tomorrow in the Western Province. Further, those who are eligible for the AstraZeneca second dose are urged to bring their national identity card and the vaccination card.
The inoculation drive of Sri Lanka commenced on the 29th of January this year, following a donation of 500,000 doses of AstraZeneca's Covishield vaccine from India. In February, came 500,000 doses of the same vaccine, which the government purchased from India's Serum Institute. Then in March, 264,000 Covishield doses were received via the COVAX facility of the World Health Organization. Then, the program hit a snag. The COVID situation in India worsened and their vaccine manufacturers had to prioritize the domestic demand. The United States suspending raw material exports needed for vaccine manufacturing too didn't help the situation. Though by then, Sri Lanka had placed an order in excess of 10 million doses of the Covishield vaccine from the Serum Institute. The company could not supply. The effects of all this are felt to this day. Over 500,000 persons who were given the Covishield first dose at the inception of the inoculation drive are still waiting for their second dose. There have been global studies since, and the World Health Organizations have even said that the 2 doses of the Covishield vaccine can be administered 10 months apart. But procuring the Covishield vaccine proved to be the problem. Discussions were held at various nations at diplomatic levels to procure the necessary jabs, and finally there was reprieve, with Japan stepping forward to assist. It agreed to donate 1.45 million doses of the AstraZeneca's Covishield vaccine doses within the month via the WHO's COVAX facility. The first batch from that, 728,460 doses to be precise, touched down in the island today at 4:25 p.m.
From tomorrow morning, we are going to start the vaccination process. We are giving priority for the people who have already obtained their first dose of AstraZeneca, and the rest of the doses will be sent to Kegol district to initiate the vaccination process there.
We believe that this first batch delivered today will help the Sri Lankan friends who have been waiting for the second dose of AstraZeneca vaccination. In addition, Japan has also provided grant assistance and technical cooperation in the amount of $16.2 million so far to assist Sri Lanka's fight against the COVID-19, which cover, among other things, provision of medical equipment, improving the cold chain system, and assistance to the returned migrant workers. Japan will continue to stand in solidarity with Sri Lanka in fighting against the COVID-19.
The latest Covishield batch takes the number of AstraZeneca jabs Sri Lanka to have procured by the way of donation or purchase to 1,992,460. The Minister of Health, Pavitra Vanniyarachi, meanwhile said that the received AstraZeneca vaccine doses will be administered in 18 MOH offices, 13 hospitals and 8 selected locations in the Colombo district. In addition, administration will also take place at 5 MOH offices in the Kalutara district and 15 MOH offices in the Gampar district. Meanwhile, on Thursday, Sri Lanka's daily vaccinations crossed the 500,000 mark for the first time, with 515,830 people being inoculated. It was also the record for the island in the single-day vaccinations. The effort was also commended by the World Health Organization in a tweet. The impressive momentum in the daily inoculation continues, as there were over 500,000 immunizations yesterday for a second day in a row. Out of yesterday's 513,741 immunizations, 508,742 were done using the Sinopharm vaccine, with 442,523 persons being given the first dose. A further 66,219 doses of the Sinopharm were administered as part of the second dose rollout. The Pfizer vaccine was also used yesterday, with 4,999 people being given the jab. As of last evening, 9,634,650 persons had obtained at least the first dose of a Covishield vaccine. Out of that number, 2,143,106 people have received both.
The progress of vaccination program is very good in Sri Lanka. For the last 2 days, we have given more than 1 million doses of vaccines. This is the highest rate of vaccination in any country in the globe. So we are very happy to announce that Sri Lanka is leading the COVID-19 vaccination program in the world.
In the meantime, the epidemiology unit says that the Colombo district had reached 102% of vaccination as of last evening with regards to the district's population of over 30s. Gampar district has achieved 99.9% of the vaccination, and in Kalutara it was 87.8%. Though the percentages suggest that the vaccination in the western province is almost over, health experts say the figures are misleading.
Even though all 3 districts in Western Province have almost reached the 100% mark compared to the estimated eligible population, we know that there are a large number of people who have not yet received their vaccines, and for different reasons. And I would urge everyone to get their vaccination as early as possible, because what we have seen is, although we have reached the 100% mark in these districts, we have given vaccines to many other persons who are temporarily residing in these areas. So therefore, when we compare the targets compared to the estimated population, we might be getting a false sense of security by seeing these statistics, as we have seen that considerable number of people are yet to get the vaccine.
Though Sri Lanka initially fell behind in vaccination over the past weeks, it has come roaring back to keep up the pace. But the global situation as a whole is still unsatisfactory.
WHO's goal remains to support every country to vaccinate at least 10% of its population by the end of September, at least 40% by the end of this year, and 70% by the middle of next year. We're a long way off achieving those targets. So far, just over half of countries have fully vaccinated 10% of their population. Less than a quarter of countries have vaccinated 40%, and only 3 countries have vaccinated 70%.
Minister of Finance Basil Rajapaksa has pledged to facilitate the reinvigoration of the country's tourism sector and other affiliate sectors. It has come during a meeting between the minister and representatives of airlines, tour companies and hoteliers yesterday. Issues faced by various sectors when bringing foreign tourists into the country were conveyed to the minister. The finance minister had said that the government will not hesitate in providing facilities towards normalising the tourism sector under a goal-oriented project. He added that the government will make other countries aware about the island's vaccination programme against COVID-19 and that talks will be held with countries which have imposed travel restrictions on Sri Lanka towards relaxing them. Veteran actress Hyacinth Wijeratne has passed away in a motor accident last night. The police say that the van she was travelling in had fallen down a 200-foot precipice in the area of Lindula in Talawakele. Reportedly, Wijeratne had been in Nuwara to film a teledrama and had been on her way back to Colombo at the time of the incident. Only the driver of the van and the actress had been travelling in the vehicle at the time of the incident. Officers of the Lindula police and the area locals had hurried to admit her to the hospital. However, the serious injuries Wijeratne had sustained took their toll and she succumbed at the Lindula base hospital. Lindula police arrested the driver of the van who sustained mind injuries and he was remanded until the 3rd of August. Wijeratne was acclaimed for her performances in Bitusituam, Karumakkaryo, Hogana Pokuna and Tarakamal. She was 75 years of age at the time of her passing.
Big 3.
Welcome back. You're watching First at 9. Now, opposition leader Sajith Premadasa is adamant that the people he housed as the Minister of Housing during the previous government will not lose their claim to the houses that they were given, no matter what challenge are posed. His views came when he visited people from 5 villages in Mattala, which is set up under the banner of Udagammana.
In 2017, opposition leader Sajith Premadasa, who was the then Minister of Housing, set up 5 villages under the banner of Udagammana near the Mattala Rajapaksa International Airport. However, the residents of those villages claim that there is a plan to oust them from the properties. With that being the case, the opposition leader met with the people in the area concerned to look into the matter.
ගෙවල් වලට ලයිට් අරන් තියනවා. නිවසකට ලයිට් දෙන්නේ ඒ පුද්ගලයා ඉල්ලුම් පත්‍රයක් දැම්මහමද නැද්ද? ඒතර එයා ඉල්ලුම් පත්‍රයක් දාන්නේ තමන්ගේ නිත්‍යානුකූල ගෙදර වෙනුවෙන් නේද?
හේන් කරන්න ඔයාලට ඉඩම් දෙන්නම්. තට්ටු නිවාස වලට කැමති නැද්ද? එහෙම කියලා කිව්වා. ඉතින් අපි කියන්නේ අපිට ඇත්තටම මේ ක්‍රමයට ඉන්න හරි ගස්සලා දෙන්න කියලා ඔබතුමාගෙන් වැඳලා ඉල්ලන්නේ.
මේ ස්ථානයේ දුන්නේ හිතාමතාමයි. ගුවන්තොටුපළ ළඟම තියෙන ඉඩමක වටිනාකම එන්නම වැඩි වෙනවා. අද මම මේ සාකච්ඡාවට මගේම නීති මණ්ඩලයේ නීතිඥතුමන්ලා 3 දෙනෙක් ඇවිල්ලා තියෙනවා තමුන්නාන්සේලා ආරක්ෂා කරන්න. කිසිම జగතෙකුට මේ ඉඩම් වලට අත තියන්න පිට තියෙන්නේ නැහැ. ගෙදරට ප්‍රශ්න කරන්නට රාජ්‍ය නිලධාරියෙක් ආවොත් කරුණාකරලා වීඩියෝ කරන්න තමන්ගේ ටෙලිෆෝන් එකෙන් මට WhatsApp කරන්න. තමුන්නාන්සේලාව මේ ඉඩම් වලින් පන්නන්නට හවුල් වෙන හැම නිලධාරියෙකුටම විරුද්ධව
In other local stories, the project where dilapidated buses of the Sri Lanka Transport Board are refurbished and transformed into libraries for schools which do not have such luxuries was launched last year in line with the concept of President Gotabaya Rajapaksa. Now then, AdaDerana, Sri Lanka Telecom Mobitel, Sri Lanka Transport Board and the Sri Lanka National Library came together for the project. Under its first phase, 5 buses transformed into libraries were handed over to schools which lacked libraries under the patronage of the head of state in line with the World Children's Day. Under the second phase of the project, 20 such buses will be made into libraries for schools across 20 districts. Some of those mobile libraries were handed over to the respective schools recently, with the Kapitigolla Hemamali Mahavidyalaya and the Katunayaka Mahavidyalaya being the beneficiaries. Welcome back. This is First at 9. Now, oil prices edged higher yesterday with global benchmark Brent posting a 4th monthly gain. Demand is growing faster than supply and vaccinations are expected to alleviate the impact of a resurgence in COVID-19 infections across the world. Brent crude futures for September, which expired yesterday, rose 28 cents to settle at $76.33 a barrel. The more active contract for October ended the session up 31 cents at $75.41 a barrel. US West Texas Intermediate crude futures rose 33 cents to end the session at $73.95 a barrel. Both benchmarks notched gains of more than 2% for the week, while Brent rose 1.6% in July, its fourth straight monthly increase. WTI was unchanged for the month. A survey has found that OPEC oil output rose in July to its highest since April 2020, as the group further eased production curbs. Top oil exporter Saudi Arabia, meanwhile, is expected to raise crude prices for sales in Asia in September for a second straight month. US stocks fell yesterday with Amazon.com shares declining after the company forecast lower sales growth, but the S&P 500 still posted a sixth straight month of gains. Amazon share sank after it reported late on Thursday revenue for the second quarter that was shy of analysts' average estimate, and said sales growth would ease in the next few quarters as customers ventured out more. Now, shares of internet and tech giants that did well during the lockdowns of last year, including Google, parent Alphabet and Facebook, were mostly lower. Amazon shares slumped 7.6%, dragging the tech-focused Nasdaq Composite down 0.7%. That fed profit-taking elsewhere, with the S&P 500 losing 0.5% and the Dow Jones Industrial Average shed 0.4%. Both the S&P 500 and the Dow had struck record highs on Thursday. And that's it from all of us here at First at 9. Thanks for watching. Bye-bye.